But now gradually we are moving from the below poverty to the universal population coverage. So now we are taking beneficiaries. And this is the hospital monitoring system. 2 and 3 levels are done by the appointed insurance company. Potential beneficiary can check his eligibility by sending his CNIC number to 8500 and verify the eligibility. There is no human intervention in who is going to decide who is beneficiary and who is not. Currently running in the program mode, but in near future is going to institutionalize, enhancing the hospital capacity, urban hubs of the provinces and the regions. But we hope, like FATA, where we 2 years ago we universalized the health insurance and more than 25 inclusion of primary health care for outpatient services in due course. And for this, we are conducting a pilot to help us and guide us in terms of its financial implications, in terms of its health outcomes, and as we say, a very English popular proverb, one stitch in time saves 9. Course of action for the program. Thank you very much for all participating in this event.
Thank you very much. Stringent monitoring and cost control. Maharashtra Society Pakistan is in collaboration with study. They will help the decision makers further to make any decision and any policy making. I would like to
Faisal Sultan, Dr. Palitha, WHO, ladies and gentlemen, Assalamualaikum, Bismillahirrahmanirrahim. My name is Islamabad. On behalf of our country director, Ms. Islamabad, unfortunately, she has a medical emergency. We all know about the demographics, but just to set up the stage, so we all know Pakistan is one of the that can change the dynamics of any country. And Pakistan has a huge potential. So, around 98% of the children under the age of 5 have developed, have growth. So, what is the impact? Population of 207 million. Population under the age of 5 is like almost 5.7 billion. Islamabad Society was established in 1990. This is our service delivery model where we have our clinics, urban clinics in the center of the areas. But far from that, in more remote and farther area, we have our outreach vans, operational planning in central health council online. We have Mashwara, we have this youth app especially dedicated for youth. Right now, our city last decade, this is our impact which has been developed through MSI Impact Estimator, MSI Productive Health Program, which gives a snapshot of programmatic activities. So, over one decade, almost 7 million family planning clients Maharashtra was able to serve, and it has generated one national contraceptive reports. So, we have delivered over 16 million short-term methods, 3.2 million long-term methods, and 0.3 million contraceptive methods. 3.3 million instances of abortion, almost 8,000 maternal deaths were prevented in this period of 10 years, and more than 50,000 we have a program. We have different MOUs with NLCH and SIN, PPHI and SIN. We have MOUs with population welfare program, interrelationship with FCDO, GFAM, Global Affairs program, World Health Organization, MSI, and these are some of our corporate sponsors. So, questions are there any candidates from that the existing program is taking the need of secondary and tertiary level. So this pilot project aims to generate evidence in local settings and political will at federal and in future provincial governments for a scale-up and delivery of integrated services to the National Sehat Sahulat Program all over the country based on the result. And the day of my presentation, that should be here is So, before I start this presentation, I would kindly like to acknowledge Global Affairs Canada, a blue road funding by which MISO was able to establish a target of general practitioners in Islamabad and then the initiative. So, this is a pilot study, 12 intervention The title is law study, and the package has been approved by the ministry. So, the design what we are using is a mixed method to arm prospective quasi-experimental control before after with randomization. There are designated service provider and facilities in the catchment intervention areas, and intervention facilities are 4 with 6 GPs in Islamabad selected facilities. I'll give you a snapshot later on. The beneficiaries will continue to take secondary and tertiary services, and for the outpatient services, they will go to their GP health outcomes we have talked about in detail. Both intervention and control areas will have 863 beneficiary families. I repeat, beneficiary families. And as per the government definition, there is the estimation of size, 5.8 family members per family. So these are the core services: reproductive health services, delivery care, only BMOC, antenatal, postnatal, newborn, non-communicable diseases, infectious. So there are some basic tests in medicine and adolescent health. These are mandatory services which will be provided in green color, and I have given you the details of their core services, the broad services. The services mentioned in the yellow, these are referral services, and the services mentioned in the blue, these will be not covered under this GP pilot because they require specific care, and these cases will be referred instantly to the secondary and tertiary level facilities, while the yellow colored services, the GPs will provide initial service and then they will refer it to the nearest government, the secondary tertiary care covered facility. This is the implementation plan. I'll give you a brief on this implementation plan at the end so that you know where we are right now standing. Inception period is almost over and the services will be started as mentioned by the respective chief guest, Dr. Faisal, from September this year. And we are using a capitation payment model in this project where we will be giving an annual payment through 4 quarterly installment. The costing was done exclusively by the Ministry of National Health Services, and that costing has been used in this project. MSS will be managing these GPs network. So these are the major deliverables. So benefit package was finalized in January, February. Intervention control areas was completed same time. Beneficiary identification and finalization was done in March. And ethics was also approved. The baseline survey was completed in the month of June and July. The training manual was developed in June and July. We have completed the training. The training of master trainer was also completed. Today is our project launch and we are commencing our service delivery from September onwards. So then there is routine monitoring by third party, and then by the end of 12 months there will be an inline survey. So this is a training manual which is approved by the government, by the WHO. These are some of the snapshots of the trainings of master trainers and the TOTs, and that's all for now. So thank you very much. Shah Saab, Mr. Saab, Zafar Saab, and Dr. Palitha, thank you very much.
Join us for our today's event on this inauguration ceremony of OPD pilot project. So thank you very much for coming here. I want to extend my heartiest gratitude on behalf of Ministry of National Health Services, Regulations and Coordination for you to come in here. It is worth mentioning here that when we started to talk about this project and then we started working about this, so it was Dr. Zafar who helped us a lot while initiating this project. And he helped us with these technical inputs as well. And he was there with us initially when we were conceiving this idea and we were working on that. I would request Dr. Zafar to kindly come on the stage and have few words. Sir, please.
Bismillahirrahmanirrahim. Janab Faisal Sultan साहब, डॉक्टर पलीथा साहब और बहुत सारे पुराने दोस्त, मैं बिल्कुल इस प्रेपरेशन के साथ नहीं आया कि मैंने यहाँ पे भी तकरीर करनी है, लेकिन ये दिस इज़ ट्रू कि ये जो पायलट अब ये लॉन्च हो रहा है, आई वॉज वन ऑफ दोज पीपल हु थॉट कि समथिंग ऑन दीज लाइन्स इज़ नीडेड इन पाकिस्तान. Mashallah, our social health insurance program is developing very well. It is evolving very well, I should say. And one question people usually ask when they come to know who can benefit from this program, and when they come to know that this person has to be hospitalized, only then the benefits will come. So from that moment onwards, there is a kind of cynicism, there is a kind of disappointment. So we thought that we will at least try to extend it to the outpatient department, to the ambulatory patients, and I'm very pleased to note this is happening today. One continues to learn, and the history of social health insurance in the world is a history of evolution of financial protection and coverage. Germany, probably in Western Europe, has one of the best health insurance programs today, and it took about 150 years for this to evolve. And vulnerable groups after vulnerable groups were brought into the coverage of this program, and one of the last vulnerable groups were, gypsies and artisans in Germany who were brought into this program in the 90s, and then they claimed that we have now universal coverage in Germany. So these programs evolve, we learn, it takes time, etc., etc. One thing I do want to mention is that perhaps people are not realizing that Pakistan, alhamdulillah, is on a very positive trajectory with reference to social health insurance and financial protection for those who cannot pay for essential health care in Pakistan. And this is something remarkable. This is happening in one generation's time. In other countries, it has taken generations. And one of the very important factors which make me feel proud citizen of Pakistan is that this program is entirely public money financed. This is government of Pakistan who has taken responsibility for this to provide financial coverage to people, and this responsibility is being delivered and taken in a very effective way. So this is something remarkable. Another very important thing which I think is very important is, and I give this credit to my friend Faisal Sultan, although I tried to do this but I could not succeed, I must admit, and that is that this program has transcended politics. And what do I mean by it? What do I mean by it is that the change of the name of this program, for which now we call it as a National Health Card, no more Sehat Sahulat Card. This has enabled all of us to at least attach hope that the succession of governments will not negatively affect this program. And the program has transcended the party politics. And all credit goes to our Prime Minister who saw the point, who agreed with the point, and he agreed to change the name of the program. And now it is called National Health Card, and National Health Card is National Health Card. Any political party, it will become very difficult, and they will have no reason on political grounds to actually, again, either minimize this program or negatively affect this program or even change the name of this program. This pilot can be groundbreaking in this sense that we will learn from this program that whether or not and how this program can be extended to those who go to primary health care in private sector to GPs, to family physicians, and who do not have ability to pay. Whether this program can cater to their needs, only time will tell. But the aim is very noble, the objective is very clear, and ultimately, if not this pilot, we will do another thing, we will do another thing. We will have to extend it to those who cannot pay in the private sector in primary healthcare. And last but not the least, the point I want to make is that for a very long period of time in Pakistan, we have looked down upon the private health sector. And we have looked at it only from the eyes of a regulator at best. That how we can twist arm, how we can police the private health sector in Pakistan. My short tenure as a Minister of Health in Pakistan, I learned one thing, that health is too important to be left to the government. Health is too important to be left to the ministries of health. Private health sector and the out-of-pocket expenditures which have been happening in Pakistan are already in the region of 60%. And we cannot continue to approach private health sector only from regulatory point of view. We have to develop a very effective partnership with them. We have to be a strategic purchaser from the private sector, and perhaps this is the best way also to improve their services rather than only policing. And I think this is one of the hidden benefits of this program, to develop a very effective partnership with the private health sector in Pakistan to help improve their services, to make them part of a national health service, which is the vision of everybody in the country. And I think the private health sector has risen already, but it will further rise to serve as a very effective partner with the government of Pakistan. I wish best of luck to the program, to have a very successful pilot, have very positive learnings from it, and so that we can extrapolate these learnings and scale them up at a larger level. I thank you very much for your attention.
I, on behalf of Ministry of National Health Services Regulations and Coordination, wants to thank World Health Organization for their support. As Sehat Sahulat Program is going to implement this OPD pilot project with the support of World Health Organization, WHO representative and head of mission to Pakistan. Sir, thank you very much for coming here. I would request you and call you on the stage to share a few words about this project.
Thank you so much, Honorable Minister of Health, Dr. Faisal Sultan, the former Minister. To take this wonderful agenda forward, are sitting together. That's really great from our point of view. Our Director, Sehat Sahulat Program, colleagues from Mahipala, and senior government officials, distinguished colleagues, ladies and gentlemen, I'm delighted to be here. I'm delighted to witness yet another key milestone in the history of health services in Pakistan. I see it as a milestone of the history of public health history of Pakistan, as we are going to involve much in universal health coverage as one of the top priority agenda of the government. The launching of the pilot Sehat Sahulat Program for outpatient services is extremely important. This initiative is a very important step for the country, as I said, to achieve universal health coverage. I think there's no doubt on this. Universal health coverage entails that all people should have access to health services they need, when and where they need them, without financial hardships. That's very important. You have the access to health services without financial hardships. That's the more important part when it comes to define the universal health coverage. Pakistan has worked so hard to design its universal health coverage benefit package, and it will be counterproductive if people of Pakistan are unable to access this package because of financial hardships. Evidence has shown that more than 100 million people globally are poverty due to health-related expenditures. In Pakistan too, catastrophic health expenditure has contributed to increased poverty levels. Is known very well. The country has out-of-pocket expenditure on health more than 60%, and 1 out of every 3 people are living in extreme poverty. Ladies and gentlemen, the government of Pakistan should be highly commended for showing impressive leadership on the health agenda by addressing this challenge to the Sehat Sahulat Program, which provides financial health protection to poor families. The commitment to enable the population receive health services that they need without financial hardship demonstrates the government's recognition of the value of health and the right to health of every citizen. World Health Organization has collaborated with the Ministry of Health in the process of defining the National Universal Health Benefit Package using the Disease Control Priority 3rd edition. I think this is the first time in the global history where DCP3 tool has been used to design and formulate a comprehensive universal health coverage benefit package. I have studied many USC benefit package. I would say the Pakistan USC benefit package, which has been already designed, is the most comprehensive I have ever seen. The Sehat Sahulat Program is currently providing financial health protection only for inpatient care services, while this pilot intervention will generate evidence for incorporating primary health care, outpatient department, and other services in its domain. That's very important. Paying for health services is a major barrier for women to access health care. It is encouraging to note that this pilot program has included sexual and reproductive health services, including family planning, to the package. That's extremely important. This will go a long way in improving access to reproductive health services to women. WHO is proud to be part of this process from the inception, and be assured of our unwavering support for the next 12 months of the pilot implementation of this initiative, as well as taking forward recommendations that will be generated, as very correctly said by Dr. Sapamisa, based on the evidence from this pilot project. Honorable Minister, distinguished guests, ladies and gentlemen, it is our sincere hope that we strive to achieve our USC targets by 2030. We promote equity and basic rights among our people, since this is not only a moral obligation, but it is also a strong foundation for long-term economic growth. Safeguarding against poverty due to medical spending will contribute to social stability, which is a prerequisite of a sustainable economic growth. I stop here. Thank you so much.
Yes, thank you very much for your kind words. It is worth mentioning here that no doubt the Sehat Sahulat Program is going to be a game changer, and I will feel honored to announce that we are no doubt going to create history.
Minister for Health, Dr. Faisal Sultan, respected Dr. Zafar Mirza, Dr. Palitha, WHO representative in Pakistan, my friends and colleagues from Ministry of Health, WHO, Civil Society, Mary Stokes, and all ladies and gentlemen who are present here. Now, first of all, thank you very much for inviting and giving me an opportunity to be here. It's a bit unfair on your part to invite me at this stage when nearly everything that could have been said has been said. लेकिन just couple of remarks. सबसे important remarks हैं ये कि we remain grateful to WHO and the partners Mary Stokes कि वो इतने important intervention में हमारे लिए एक pilot करने जा रहे हैं. सेहत सहूलत प्रोग्राम की जो intervention है और उसका जो impact beneficiaries पे है, अब उसके असरात सामने आना शुरू हो गए हैं. बहुत सारी ऐसी फैमिलीज़ जो ऐसी बीमारियों की वजह से या मुस्तकिलन बीमार हो जाते थे, अपाहज हो जाते थे या घर उजड़ जाते थे, मोटरसाइकिल, रिक्शा, घर बिक जाता था जिनके इलाज के लिए. अब उन तमाम फैमिलीज़ को जो सेहत सहूलत प्रोग्राम फैसिलिटीज़ और बेनिफिट प्रोवाइड कर रहा है, अब उसका एनेक्डोटल डेटा तो है ही है, अब उसका एनेक्डोटल एविडेंस भी रिकॉर्ड पे आ रहा है. प्राइम मिनिस्टर की इंस्ट्रक्शन पे, जैसा कि आप सब जानते हैं, इसका हॉरिजेंटल स्केल अप शुरू हो गया है। KPK में यूनिवर्सल पॉपुलेशन को इंश्योरेंस कार्ड दिया गया है। पंजाब में 36 में से 7 डिस्ट्रिक्ट्स में प्राइम मिनिस्टर ने मई में यूनिवर्सल हेल्थ इंश्योरेंस को लॉन्च कर दिया है और प्राइम मिनिस्टर की इंस्ट्रक्शन पे गवर्नमेंट ऑफ पंजाब, मिनिस्ट्री ऑफ हेल्थ इस्लामाबाद, सेहत सहूलत प्रोग्राम, हम इस पे काम कर रहे हैं कि बाय द एंड ऑफ दिस कैलेंडर ईयर हम सारे पंजाब की पॉपुलेशन को यूनिवर्सल हेल्थ इंश्योरेंस के एम्बिट में ले आए। तो ये हॉरिजेंटल उसकी एक्सपेंशन और स्केल अप तो हो गया। दिस पायलट प्रोजेक्ट आई बिलीव इज अ फर्स्ट स्टेप टुवर्ड अ जर्नी ऑफ 1000 miles फॉर द वर्टिकल स्केलिंग अप ऑफ दिस इनिशिएटिव, जिसमें हम OPD को भी इसके अंदर इनकॉर्पोरेट करेंगे। I would like Mary Stokes to make a note that we will be kind of observing very carefully how this pilot goes forward. इसमें ये and this pilot can actually make or break this further expansion of this project, which I believe will be a great opportunity for us to learn how this works, what are its financial implications, और कल को हमने इस इनिशिएटिव को भी उसी तरह स्टेज मैनर में हम इंट्रोड्यूस करेंगे या यूनिवर्सल लेवल पे करेंगे। तो देयर आर many things for us to learn in this initiative, which I believe we will, inshallah, with the help of WHO and Mary Stokes Foundation. Towards the end, thank you very much once again. Assalamu alaikum.
Thank you very much for coming here, sir.
First of all, I would like to request Dr. Sonia Riaz, Deputy Director, Sehat Sahulat Program, to give the certificate.